my name is Sandra, and I'm going to be conducting a neurological evaluation on you today. Okay, I'm just going to ask you some questions related to family or personal history of neurological conditions and medical history, okay?
Okay.
So tell me what brings you in today.
So last week I had a fall, and I've been having some pretty bad headaches, and I went to the emergency room. They couldn't find anything, but I just want to make sure that everything's okay.
Okay. And tell me about any personal or family history of medical or neurological conditions.
Really none that I can think of, and besides going to the emergency room for my fall, I haven't really been hospitalized in the recent past.
Okay. And tell me about your work and day-to-day activities.
So I work as a school teacher, so most of my days are filled with teaching or planning, and then really on the weekends and the evenings I just try to relax.
Okay. So we're going to start with the mental status exam, and this is going to assess your memory, your attention, language, reasoning, and orientation. Okay? So, here's a pencil for you. So, I want you to please draw a line going from a number to a letter in ascending order. So we're going to start here and then go from here, 1 to A, and then A to 2, and so on. And I want you to end at E, okay?
Okay.
Okay. So do you see this drawing here?
Yes.
Okay, I want you to copy it as accurately as you can on the space below. Okay, and in this space, I want you to draw a clock with all the numbers in it, and then I want you to set the time to 10 past 11. Okay, tell me the name of this animal.
A lion.
And this animal?
A rhino.
And this animal?
A camel.
Okay. So this is a memory test. I'm going to read a list of words that you'll have to remember now and later on. Listen carefully. When I am through, tell me as many words as you can remember. It doesn't matter in what order you say them. Face, velvet, church, daisy, red.
Face, velvet, church, daisy, red.
Okay. I'm going to read the same list of words a second time. Try to remember and tell me as many words as you can, including the words you said the first time. Face, velvet, church, daisy, red.
Face, velvet, church, daisy, red.
Okay. I will ask you to recall those words at the end of the test. Now I'm going to say some numbers, and when I am through, repeat them to me exactly as I say them. 2, 1, 8, 5, 4.
2, 1, 8, 5, 4.
Okay. Now I'm going to say some more numbers, but I want you to repeat them to me in backwards order. 7, 4, 2.
2, 4, 7.
Okay. Now I'm going to read a sequence of letters. Every time I say the letter A, tap your hand like this.
Okay.
If I say a different letter, do not tap your hand. F, B, A, C, M, N, A, J, K, L, B, A, F, A, K, D, E, A, J, A, M, O, F, A, B. Okay, now I'll ask you to count by subtracting 7 from 100. Then keep subtracting 7 from your answer until I tell you to stop. Okay? Go ahead.
100, 93, 86, 79, 72, 65.
Okay, stop. Now I'm going to read you a sentence. Repeat it after me exactly as I say it. I only know that John is the one to help today.
I only know that John is the one to help today.
Okay. Now I'm going to read you another sentence. Repeat it after me exactly as I say it. The cat always hid under the couch when dogs were in the room.
The cat always hid under the couch when dogs were in the room.
Okay. Now I want you to tell me as many words as you can think of that begin with a certain letter of the alphabet that I will tell you in a moment. You can say any kind of word you want except for proper nouns like Bob or Boston, numbers, or words that begin with the same sound but have a different suffix. For example, love, lover, or loving. I will tell you to stop after 1 minute. Are you ready?
Mm-hmm.
Okay. Now, tell me as many words as you can think of that begin with the letter F. Go.
Lake, farm, fawn, fun, far, form, from, falcon, frog, fox, fancy, fuzzy, firm, forest.
Okay, stop. Great. Now tell me how an orange and a banana are alike.
They're fruits.
Okay. Now tell me how a train and bicycle are alike.
They're transportation.
Okay. Now tell me how a ruler and a watch are alike.
They measure things.
Okay. So I read some words to you earlier, which I asked you to remember. Tell me as many of those words as you can remember.
Church, velvet, face, daisy, red.
Okay. Now tell me the date today.
It's Sunday, March 3rd, 2019.
Okay. Now tell me the name of this place and which city it is in.
This is my house in Silver Spring, Maryland.
Okay, great. So, normal findings on the MOCA would be a score of 26 or above, which would indicate normal cognitive skills or cognition, and then a 26 or below would indicate mild cognitive impairment or Alzheimer's disease. Okay, so now I'm going to conduct a cranial nerve exam to assess how the nerves in your body function, okay? So first, I want you to hold one of your nostrils and close your eyes. And I'm going to ask you to tell me if you smell something and then identify what that smell is if you can, okay?
Okay.
All right, so hold one of your nostrils. Okay, what is it?
Lemongrass.
Okay. And then the same thing with the other nostril. What is it?
Orange.
Okay, great. So we just assessed the olfactory nerve, cranial nerve number 1, which is responsible for our ability to identify and smell in general. So that would be the normal finding. And then abnormal findings, the patient would not be able to know that there is a smell and would not be able to identify what that smell is. Okay. So now I want you to hold this chart about 14 inches away from you. And I want you to just read the line with the smallest letters that you can read, okay? And close one eye.
P, F, C, O, T.
Okay, and now do the same thing with the other eye.
N, F, D, O, H.
Okay, great. Now I want you to cover one eye, look straight ahead, and then tell me how many fingers I'm holding, okay?
2, 1, 1, 2.
Okay. Now do the same thing but with the other eye closed.
2, 1, 1, 2.
Okay. So we just assessed the optic nerve. So normal findings would be 20/20 vision for normal visual acuity, and then Normal findings would also be that the patient could see all 4 visual fields, and then abnormal findings would be a low or a decreased visual acuity score, which would indicate optic nerve damage. And then if the patient, for example, was not able to see in their left visual field, then we would say they have ipsilateral blindness. And then if they are not able to see in their 2 lateral visual fields, for example, we would say they have bitemporal hemianopia. Okay. So now, I want you to try to keep your eyes open, okay? Okay. So we just assessed the pupillary reflex of the oculomotor nerve. So normal findings would be normal constriction of the pupils, and then abnormal findings would be either direct constriction, which would indicate ipsilateral lesions, or consensual constriction, which would indicate contralateral lesions. Okay. Now, I want you to follow my finger, okay? So look straight ahead. Okay. So we just assessed the abducens, the abducens, the trochlear, and the oculomotor nerve. So normal findings would be that the patient could follow the finger laterally, infranasally, and then all other eye movements. And then a lesion for the trochlear nerve would be that the patient could not follow the eye movement infranasal. And then abducens would be that they have difficulty with the lateral movement. And then oculomotor would be all other eye movements. Okay. So now I'm going to use a Q-tip and this thumbtack. You want to feel them. And I'm going to put them on your face, and I just want you to tell me when you feel something and where, okay? So close your eyes.
My forehead, my cheek, my jaw.
Okay. Now the same thing.
My cheek, my jaw, my forehead.
Okay. So we just assessed the sensory component of the trigeminal nerve. So the patient is able to feel in their upper, middle, and lower face. So deficits would be that they would not be able to feel sensation either in their upper face, their middle face, or their lower face. Okay. So bite down hard for me. Okay. I'm going to try to open your mouth, but don't let me, okay? Resist. Okay, now open your mouth. I'm going to try to push it up. Don't let me. Okay. Now maybe draw to the side like this. I'm going to try to push it in the middle. Don't let me. Okay. I want you to open your mouth slightly. Okay. So we just assessed the trigeminal nerve, the motor component. So intact, normal findings would be intact muscles of mastication and then absence of a jaw reflex. Abnormal findings would be that the patient has difficulty with muscles of mastication, and then a presence of a jaw reflex we could say that they have an upper motor neuron lesion. Okay, now I want you to wrinkle your forehead like this. All right, close your eyes tight. Show your teeth, smile. Purse your lips. Okay, now stick your tongue out. Okay. I'm going to put a flavor on your tongue on one side. Okay, so don't put your tongue back in until you can tell me what the flavor that I give you is, okay?
Sweet.
Okay, same thing on the other side. Stick your tongue out. Okay, so we just assessed the facial nerve, so the muscles of facial expression, so the patient was able to smile and then move the muscles of their face, and then we tested sensory component of the facial So if the patient is able to determine the taste, they have intact anterior 2/3 of the tongue for taste intact. If the patient was not able to close their eyes tight, for example, there could be a problem with the orbicularis oculi muscle. And then if the patient was not able to determine the taste, then we would assume that they have taste sensation deficits. Okay. Now close both of your eyes, okay? I'm going to, you want to tell me if you hear a sound and which ear you hear it in, okay? Okay. Now I'm going to put a tuning fork in the middle of your head. Tell me if it sounds different or more, you hear the sound more on one side or the other, okay?
No, it's the same.
Okay. Now, look at this pen straight ahead, and I want you to continue to look at it while you turn your head to the left and the right, and then up and down, okay? Okay. So we just assessed the vestibular cochlear nerve. So normal findings would be that the person has intact hearing, that the tuning fork sounds the same on both sides of on both ears, and then the person has an intact vestibular ocular reflex, so they can fixate on the object in front of them and then move their face accordingly. And then deficits for this would be abnormal hearing, so one side of the tuning fork sounds louder on one side, for example, and then there's deficits with the reflex, so they're not able to stay fixated on the object. Okay. Now, I want you to open your mouth and say ah, ah, and say ka, ka. Okay. Now, open your mouth. I'm just going to stick something in there. Okay. Okay, good. Okay, so we just assessed for the glossopharyngeal and vagus nerve. So for the presence of a gag reflex, that would be normal. And then normal would be symmetrical elevation of the palate, and there was no nasal emission or nasal air escape when saying R, ka. Deficits for this would be that the patient had asymmetrical elevation of the palate, and that there was nasal air escape, which would indicate bilateral weakness. Okay. I want you to shrug your shoulders. Okay. Now, I want you to turn your head to the left in a second, and I'm going to apply resistance, but don't let me, okay? Okay, same thing on this side. Okay, great. So we just assessed the accessory nerve, so that's the muscles of the neck, so normal findings would be intact neck muscles, and then abnormal findings would be deficits with the sternocleidomastoid or the trapezius muscle. Okay, stick your tongue out and move side to side. Okay, great. Now, I'm going to try to push your tongue in, but don't let me. Okay, stick it out. Awesome. Okay. So, normal findings for this would be an intact hypoglossal nerve. So, the patient has normal tongue movements, and then abnormal findings would be that the patient had weak tongue movements, and that we would look for atrophy or fasciculations. Okay, now we're going to move on to a coordination exam, just to test your balance and coordination, okay? Keep this glove on. I want you to say lepaka as fast as you can.
Lepaka, 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 lepaka.
Okay, now I want you to take your pointer finger from your nose and up until my finger, okay? Keep going. Awesome. Okay, so we just assessed the patient's coordination. So this is normal findings would be normal movement of the tongue, lips, and palate, and normal cerebellum function. And then abnormal findings would be abnormal movements of the lips, tongue, and palate, and then cerebellum dysfunction such as dysmetria. Okay, now I'm going to flex and extend your arm. Okay, just try to relax. Okay, now the other arm. Okay, and I'm going to do the same thing with your legs, okay? Awesome. Okay, so we just assess the patient's tone of the upper extremities and the lower extremities. So normal findings would be normal tone, and then abnormal findings would be hypo or hypertonia, and the patient could show spasticity or rigidity too. Okay, now I'm going to test your strength. Okay, I want you to flex your arm, and I'm going to try to extend it, but don't let me. Okay, same thing with this one. Okay, and now I want you to extend your arm, and I'm going to try to flex it, but don't let me. Okay. Okay, so we just assessed the patient's strength, which is scored from 0 to 5. So 0 would be a normal strength, no contraction, and then 5 would be abnormal, so there's full range of motion and full resistance. Okay, finally I'm going to do a sensory system test, okay? I'm going to ask you to close your eyes and tell me dual or sharp, okay? So I'm going to use those same objects we used before, a new Q-tip and then a sharp thing. You can feel them. Okay, so you can take off your cardigan. Okay, so just tell me sharp when you feel something sharp or something dual when you feel something dual.
Sharp.
Okay.
Dull. Sharp. Dull.
Okay, great. Okay, now I'm going to ask you to close your eyes and stick your hand out, and I'm going to move your thumb either up and down, so tell me which way your thumb is, okay?
Up. Down.
Okay, same thing with the other hand.
Down. Up.
Okay. And now I'm going to place an object in your hand, and I just want you to tell me what that object is. Okay, so close your eyes.
A cell phone.
Okay.
A comb.
Okay, great. Okay, finally, I want you to tell me the letter or number that I trace on your palm. Okay, so close your eyes. P. Okay, same thing with the other hand.
4.
Okay, great. So we just assessed the patient's sensory system. So normal pain sensation, they can differentiate between something sharp and something dual. We assessed the patient's position sense with their thumb, and then sternocleidosis and graphesthesia. And then abnormal findings would be an absence of sternocleidosis and graphesthesia. The patient has difficulties with position sense, and then they say they have abnormal sensations such as pain or pins and needles, and then they can't differentiate between dual or sharp. Thanks, Claire. Do you have any questions for me today?
Nope, thank you.
Thanks.